Welcome to the Institute of Mental Health. IMH is the tertiary psychiatric hospital in Singapore. Nestled in the greenery of one of the densest suburbs northeast of the city, we're part of the National Healthcare Group. Aside from treating those with illness, our role in improving the mental health of our nation is equally important. The River of Life illustrates the scope of our work, from preventive strategies upstream to tertiary intervention downstream. The River of Life incorporates the physical, mental, and social dimensions of health, from cradle to grave. Key outcomes include building a mentally healthy and resilient population and ensuring accessible and affordable care to improve patient outcomes and experience. In order to serve our patients, meet the needs of the people of Singapore, and develop our staff, we have developed 3 master plans to guide our long-term strategic planning. These are the Clinical Master Plan, the Campus Master Plan, and the Human Capital Master Plan. Let's take a closer look at each of these.
Our clinical master plan was drawn up to address the growing mental health needs of our population and to transform the model of care that will sustain us over the next 10 years. The stepped care model, developed by the Interagency Task Force on Mental Health and Wellbeing, outlines 4 tiers of mental health needs within the Singapore population. These tiers span individuals who are healthy, at risk, or mentally unwell, which can be described in the social metaphor of the River of Life. Upstream, IMH will provide thought leadership in the promotion of mental health and help build capability and capacity to do early detection and intervention, even as we deliver tertiary psychiatric care. The care coordination model is a patient-centered framework where a single point of contact works with other stakeholders to provide seamless care for patients across different settings and time periods. The post-discharge phase is often challenging, and our transitional care program aims towards timely discharges and collaborates with local social service agencies to facilitate patients' reintegration into the community. Another strategy we have to keep patients well in step-down facilities like nursing homes is through our virtual ward program. This helps to reduce the need for admissions to IMH and minimizes disruption to the patient's nursing regime and mental state. Technology has greatly enabled care delivery in this community-based setting. Lastly, we recognize the importance of providing both mental health and medical care to our patients. Our integrated medical care model fosters interdisciplinary collaboration between medical and mental health professionals.
To better support our model of care, as well as prepare for future expansion, improvement in our infrastructure need to be made. Our Campus Master Plan is set to enable clinical symptom recovery, as well as functional and psychosocial rehabilitation for our patients, create a more conducive work environment, and eventually increase our capacity for inpatient care. We have refurbished 11 wards that cater to adults, children, and adolescents, as well as patients with addictions. We now have a short stay unit that enhances our provision of differentiated care and a ward where recovery-oriented principles and early rehabilitation will be primary. We also have a smart hospital strategy that comprises 3 pillars. The first is digital hospital, where we look at smart healthcare solutions that will support end-to-end care for patients. The intention is to cover all touchpoints from access to care to community. The second pillar is the innovative hospital, which will strengthen capabilities so as to enable staff, patients, caregivers, and partners to innovate. Lastly, as a green hospital, we want to manage 3 elements well: waste, water efficiency, and energy efficiency. Our commitment to these 3 pillars is so that we can provide the best possible care for patients while reducing environmental impact.
A competent, productive, motivated, and engaged workforce is critical in our delivery of high-quality mental health care to Singaporeans. Supporting this, the Human Capital Master Plan outlines our attraction, development, and retention strategies to achieve the optimal capacity and the relevant capabilities to meet our clinical needs. One of our initiatives is a job redesign exercise, which will create an additional source of workforce capacity. We have tapped on gig workers and provided training for them to perform specific daily assisted living activities so that our healthcare professionals can focus on delivering quality care to our patients. We believe that the key to providing quality integrated care is collaboration. Working towards that, we continuously support our healthcare professionals to develop transdisciplinary competencies, thereby enabling them to provide seamless care and deliver better outcomes for our patients. To build and sustain an engaged workforce required the provision of a clear sense of purpose, positive work environment, opportunities for professional development, and competitive compensation and benefits. To strengthen this, we are fostering a culture of open communication, feedback, and recognition, where our workforce will feel that their voices are heard, their needs are attended to, and that their contributions are valued.
It has been increasingly recognized worldwide that mental health should be a top priority. Apart from world-class treatment for persons with mental illness and an environment that focuses on recovery, we have a role in maintaining the well-being of our population. As we save lives downstream for patients in crisis, we also improve lives of those in our population through better coping and resilience, so that the next generation will be ready to swim confidently in the river of life.